Before you spend another $30, $40, or even $60 on an anti-inflammatory joint supplement, read the label carefully. The celebrated ingredient inside many of those capsules begins with a yellow kitchen spice that may cost only a few cents per serving. That spice is turmeric. But does the pharmaceutical industry truly hate it? There is no evidence of a secret campaign against turmeric. The more useful truth is simpler. Companies can sell a concentrated extract for a premium price, while the original spice remains inexpensive, familiar, and largely overlooked. Today, you will learn what turmeric may actually do and where the claims go too far. Joint discomfort can quietly become a monthly expense. One bottle promises flexibility. Another promises healthy cartilage. A third contains curcumin, black pepper extract, ginger, boswellia, or several ingredients combined. The labels use scientific language. The prices suggest that something powerful must be inside. But after several weeks, many people are still unsure whether the product made any real difference. They may also use anti-inflammatory pain medicines when the discomfort becomes difficult to ignore. These medicines can be valuable, but in older adults, frequent use of certain anti-inflammatory drugs may increase the risk of stomach bleeding, kidney problems, and cardiovascular complications. That does not mean you should stop a medicine prescribed by your doctor. It means you deserve a clear explanation of your choices. Welcome to the channel, where we examine affordable health habits without fear, conspiracy, or miracle promises. Today we are separating three things that are often confused: turmeric the food, curcumin the plant compound, and curcumin supplements, which may deliver much more than an ordinary meal ever would. Turmeric comes from the underground stem of a plant related to ginger. It has been used in South Asian cooking for centuries and has a long history in traditional practices. Its golden color comes partly from natural compounds known as curcuminoids. The best known is curcumin. Curcumin is the name you often see printed in large letters on expensive joint support bottles. Researchers study it because laboratory evidence suggests it can influence several biological pathways connected with inflammation and oxidative stress. To understand this, imagine inflammation as a network of volume controls. The body needs some inflammation. It helps respond to injury and infection. But in an irritated osteoarthritic joint, several inflammatory signals may remain louder than necessary. Curcumin appears to interact with some of the switches involved in those signals. Think of it not as putting out a fire instantly, but as gently lowering the volume on several alarms. This may help explain why some studies of turmeric or curcumin extracts have reported modest improvements in knee pain, stiffness, and daily function. Some participants found walking, climbing stairs, or rising from a chair a little more comfortable. Recent research reviews have generally found a possible benefit compared with placebo, but the quality of the evidence remains limited. Many trials included relatively few people. They lasted only a few weeks or months, and they tested different products with different doses and absorption technologies. That last point is crucial. Most clinical studies did not ask people to sprinkle ordinary supermarket turmeric onto dinner. They used concentrated preparations. Some delivered hundreds of milligrams of curcuminoids. Others added piperine from black pepper or used special formulations designed to help the body absorb more. Kitchen turmeric and a concentrated extract are related, but they are not interchangeable. Think of an orange and a vitamin C tablet. The tablet may contain a measured, concentrated dose. The orange contains vitamin C as part of a complete food. Both may have value, but they are not the same product. Ordinary turmeric contains only a limited amount of curcumin, and the body absorbs curcumin poorly. Much of it is broken down and removed before reaching the bloodstream. That means a small amount in food should not be expected to act like a high-dose supplement. It also means that adding more and more turmeric is not a sensible way to copy a clinical trial. Higher absorption is not automatically better. Some enhanced curcumin supplements have been linked with rare liver injury. Concentrated products may also interact with medication or cause nausea, reflux, diarrhea, or other digestive symptoms. The honest conclusion is this: turmeric is a useful culinary spice with promising biological properties. Concentrated curcumin may modestly help some people with knee osteoarthritis, but neither form rebuilds cartilage, reverses arthritis, or replaces an individually chosen medical treatment. And there is no evidence that pharmaceutical companies are hiding a 10-cent cure. The real problem is exaggerated marketing on both sides. One industry may oversell expensive capsules. Online influencers may oversell the kitchen spice. Trustworthy advice sits between those extremes. Here's a simple way to use turmeric as food. This is a culinary routine, not a treatment dose. Begin with approximately 1/4 teaspoon once a day. Mix it into a meal rather than swallowing the dry powder. You could add it to scrambled eggs, lentil soup, beans, rice, roasted vegetables, chicken, fish, or stew. Choose food you already eat. That makes the habit inexpensive and easy to maintain. Use it with a normal, balanced meal. A meal containing a small amount of olive oil, eggs, yogurt, nuts, seeds, fish, or avocado may help the curcumin mix with dietary fat. There is no need to prepare a heavy or greasy drink. Continue the 1/4 teaspoon for several days. Notice whether it causes reflux, nausea, abdominal discomfort, constipation, or diarrhea. If you tolerate it comfortably, you may increase to approximately 1/2 teaspoon per day. You can use it in one meal or divide it between 2 meals. There is no reason to consume large spoonfuls. More does not guarantee greater relief. It may only create more side effects. You may have heard that black pepper makes turmeric stronger. Piperine, a compound in black pepper, can increase curcumin absorption. But concentrated piperine may also change how the body processes certain medicines. A normal culinary pinch is different from a high-dose black pepper extract. If you take several prescriptions, blood thinners, diabetes medicine, or medication with strict dosing instructions, speak with your pharmacist before deliberately trying to increase curcumin absorption. Next, measure whether the routine is doing anything useful. Do not rely on one unusually good day. For 3 or 4 weeks, record your discomfort from 0 to 10. Also, choose one daily activity. It might be walking to the mailbox, climbing 1 flight of stairs, standing from a chair, or shopping for groceries. Record whether that activity becomes easier, stays the same, or becomes harder. Do not start turmeric, 3 supplements, a new medicine, and a new exercise routine on the same day. When everything changes at once, you cannot identify what helped or what caused a problem. And remember what usually matters most for osteoarthritis. Appropriate strengthening can help the muscles around the joint share the load. Regular movement helps preserve mobility. Good sleep, activity pacing, physical therapy, and gradual weight reduction when appropriate may provide more benefit than any single spice. Turmeric should be one small instrument in the orchestra. It should never be asked to play the entire piece. Always consult your doctor or pharmacist before changing your routine, especially if you take blood thinners, diabetes medication, several prescriptions, or have liver, digestive, or kidney stone concerns. Stop using turmeric or curcumin and seek medical advice if you develop persistent nausea, unusual fatigue, poor appetite, dark urine, or yellowing of the skin or eyes. Do not stop prescribed pain medication because of this video, and seek professional assessment if a joint becomes suddenly red, hot, severely swollen, injured, unstable, or impossible to bear weight on. The lesson is not that Big Pharma fears turmeric. It is that the ingredient advertised on an expensive bottle may have started with a common kitchen spice, and that price alone does not prove value. Have you tried ordinary turmeric or a curcumin supplement for joint discomfort? Did you notice a genuine difference? No change or unwanted side effects? Share your experience in the comments below. For more calm, affordable, science-based health guidance for adults over 50, consider liking this video and subscribing to the channel. Do not trust a product because it is expensive, and do not trust a remedy simply because it is natural. Trust evidence, careful observation, and informed medical advice.